I'm Merle Reeseman and a pulmonary hypertension patient. It was back probably in the late 90s. I wasn't feeling well. I was a very active person. Went from this doctor to the next doctor, and the one doctor says, you need to see a specialist. I went to a cardiologist, and he said, whoever read this EKG or echo doesn't know what they're talking about. You need to go to the Cleveland Clinic, and that's where I went. When I first went to the clinic, they said, you have a clean body, and which meant I was not on any kind of medications. And would I mind trying this and mind trying that? And, they went through a lot of trials. And I got to the point where they said that's it, you need to be on medicine, because they first tell you you have 2 to 6 years to live without medication. And too many patients don't hear the without medication. So my 2 to 6 years went to like 2 to 3 months. And then they put me on the only IV medication that was available at the time, the only medication that was available at the time. And I was on that for about 10 years. And then we decided, because of the distance from my home to the clinic, which again is 2.5 hours, it only is what I call a 15-minute shelf life. So I had to be put on a different IV medication. Now there are 3 IV medications. There's 14 medications now available. And as I mentioned, there was only one when I was first diagnosed. My one doctor said he's going to change Murphy's Law to Merle's Law, because if anything's going to go wrong, I will be right in the middle of it. And it's proven to be true. I just happen to be one of those people that if something's going to go askew, I'm there. I went for a right heart cath, and I had a fellow, not quite a specialist, but a doctor yet. And he went up through my heart for the catheterization, and he went up this much further, and he found an anomalous pulmonary vein return. Your blood goes from your heart up to your lungs, back down into the left side of your heart, and throughout your body with fresh oxygenated blood. Well, mine didn't. It came back down into the right side of my heart, which caused the right side of my heart to enlarge, which basically gave me the pH. So rather than having idiopathic pH, and I always said I had to be an idiot to get it, I had a cause, a reason. So I had open heart surgery. They said I'd be in the hospital 4 to 6 days. 3 months later, I was sent home. I could not walk. I could not do much of anything. Had rehab and everything at home for 6 months. Then I got out the door and went to PT and all that for another 6 months. So I lost a whole year there. But I'm here. People think, well, a specialist is a pulmonologist or a cardiologist. Sure, they're specialists for certain things, but they may not be a pH specialist, and that's the difference. We need to find a pH specialist who understands the disease and can diagnose and prescribe the proper medication. I mean, now there's 14 medications out there with more on the way. Years ago, I was doing some search on the internet, and the local TV station had a little thing. If you have some kind of a disease and would like to tell us about it, contact us. So I called, and I just wrote, I said, I have this rare disease. They've told me I have 3 to 5 years to live. And I stopped right there. I got a phone call. I mean, if you make it sound scary, they will call you. So I had the TV reporter come. I showed them all my medicine, how I have to line it up, how I have to mix this and do that and everything. And I said, can I say this on TV? And she said, what? And I said, well, I don't want people to end up like me with a hose in the nose and a tube in the boob. That went viral. I want to leave you with an excerpt of a poem that I wrote. I used to be healthy. I used to be strong. I used to work most all the day long. And then it hit me without even a clue. I wasn't quite sure just what I could do. I saw many doctors. I had many tests. And then I was diagnosed with IPAH, and you know the rest. Now there's 3 pages, and I'm not going to go through all that. But that gives you an idea, because I was healthy. I was strong. I did work all the day long. But, now I can't. And it's just, you go from here to here. And little or no time at all. And to some people, it's overwhelming. They don't understand why. And that's when you need to ask your doctor, why? Why is this happening? What is this disease about? And then learn as much as you can. Now, a lot of people said they don't go on the www. Well, some people need to, but you have to get an updated version. Check the dates on anything that's on the internet. And last but not least, remember to smile, because smiles are contagious, you see. And when you feel down and put on a frown, turn that frown upside down, just for me, because smiles make us happy and will help us cope with having this dastardly pulmonary hypertension disease. I'm Merle Reeseman, and I'm aware that I'm pH rare.